All right. Happy Friday. Happy Friday, everyone. Welcome back to another edition of EPM's Empower Our Life. It's Friday. It's Friday, the end of the week and the last day. Glad to have everybody here. You guys are awesome as always. Thank you for joining. Elizabeth, happy Friday. Yeah, guys, hit the chat, man. I want to hear from you guys. Everybody hit the chat real quick. Let Billy know you're in the building. Everybody hit drop a good happy Friday or a good day or a hello or anything in the chat. We love the participation. There you go, John. Happy Friday. The Don. Okay, Don, your name. Don changed his name to the Don yesterday in 4 core classes. I guess that's gonna stick. So Don, you are now the Don for sure. Suha. Man, Suha's in the house. Narizi. Good. So we have people coming in. I love that. Adair Z, the Don. Yes, sir. Thank you guys for checking in. It is Friday here in Atlanta. It's actually a good day. It's like very good, very pretty outside. It's supposed to be a 40% chance of rain. I'm not sure if that's going to happen. I don't know. Billy, do you guys like I'm gonna introduce you, but I just have a real quick question as a fire officer. What do you call it? Fireman, fire officer,
firefighter,
firefighter,
inspector, and yeah, whatever you like to call me. I'll answer.
Just scream fire in your answer. I love it. Do you guys wake up and check the weather and then you're just like, oh man, this is going to be a horrible day?
Actually, yes, we do. Because if you have the rain, you're going to have car wrecks, and you kind of just mentally prepare for that before you ever get to the station.
It's like, hey, Gene, hey, Sarah. It's like that even for normal people. So I know it's like that's a heightened sense of weather for you guys. Weather
it is.
I swear, at least here in Atlanta, if I see a few drops of rain, it seems like 10 minutes later I hear sirens.
So 100%. Yeah, you always will. Unfortunately, people just forget how to drive.
Just quickly, and that's a testament actually to how fast you guys respond because you guys are on it. Hey everybody, thank you guys for joining. I'm just talking with my man Billy here while we let the numbers come in. And dude, who said that? The Don. I just realized the Don just called you Fire Marshal Bill. You know who Fire Marshal Bill is, right?
He wouldn't be the first, but he would be the first today.
The Don beat me too. It actually just dawned on me that your name is Billy. And oh my God,
right.
Fire Marshal Bill.
Yep.
Do you lean into that? You don't mind, right?
Don't mind at all. Okay, don't mind at all.
Okay, cool. Yeah, you definitely got to lean into that because that's perfect. That's just perfect Billy.
Yeah.
So guys, today we have a very, very special situation, a very special guest. We're all about empowering you guys, and this time we want to empower you to be a phenomenal first responder or just aware of what has to happen in first aid type situations. There are a lot of near misses, but then there's a lot of times those near misses actually become situations. And in those times, we want to know how to act and how to respond. So today we have Billy Pildner from the Sandy Springs Fire Department, and he's just going to give us a few points on how to be better at first aid and just be better individuals altogether. You guys, please listen, please take notes, please ask questions in the chat. Billy, would you care to say a few things about yourself? Tell us how long you're doing, what you're doing, and all this stuff.
Sure. Again, my name is Billy Pildner. I'm with Sandy Springs Fire Marshal's Office. I've been here almost 7 years, but I am in my 30th year as a career firefighter. I actually live on the south side of Atlanta, and I drive up here every day. Absolutely love my job, love what I do, and happy to be here with you guys.
Let me ask you, south side of Atlanta, where are you at?
I'm in Henry County, and I live in Locust Grove.
That's what I thought you were getting at. I live in on the back. I live in North Henry, it's called, but Stockbridge.
Oh, okay.
Yeah, so I make a similar commute, and I come up here, and I myself wake up, look at that traffic report, and I'm like, oh man,
right,
I'm about to catch you. So we have a similar commute. I jump on 675 to 285. I don't have to go quite to 75 like you do, but
I've kind of taken all the different routes trying to figure out, and you just never know.
Exactly, you're 100% correct. You had a PowerPoint presentation you wanted to share with us.
I do.
All right.
I do, and we're going to talk about basic first aid today.
All right. Right now it's just showing your desktop background, so it's probably just slid over a little bit.
Okay.
Yeah. It was up. It was up initially, and then it disappeared.
Okay.
It's there somewhere, I'm sure. me just make sure it's not my screen. Do you guys see the desktop or you guys see the presentation? The Don, Jean, Sarah, the Don. All right, so Suha says desktop still, so yeah. It's there somewhere because it was definitely there before. If you want to, you could just cancel the screen share and maybe just restart it. That's
okay. All right.
Yeah,
man, I apologize for all that.
Hey, you are fine, man. Technology is amazing. When you need it, it's there, and when you need it, it's also not there.
All right, so let's see if I can get back to it.
So we're going to stop your screen share.
Okay.
And then you can go ahead and restart it. I just stopped yours.
Okay.
Right now, your camera's off, so we only see the name.
Okay.
And just while you're doing this, big shout out to Christopher Campbell. He was going to join us. He's also a member of the Sandy Spring Fire Department, but he just got uplifted to fire marshal. So big ups, Chris, and that's awesome.
Yep, he is now my boss, and he had other things he had to do today because, you know, being the new chief and the new boss, he asked me if I could come and do this. So I was happy to do it.
And we are happy to have you. You're just as qualified, so we are fine with that. So we do actually see your first aid, your PowerPoint now.
Okay, perfect. All right. Well, I apologize for that little snafu at the beginning. Again, everybody, thanks for being here. I won't take up all of your time. I know time is valuable and precious like everywhere else. And
that's just me asking to turn the camera on because your camera went off.
Oh, okay. Okay. There we go.
Yep.
Okay. And so yeah, we're here to help you guys in any way we can. And this is just, you know, what we do, especially for all of our just people that come through Sandy Springs. You know, we don't want to just confine ourselves to a citizen or just anybody. So if you live, work, play, come into Sandy Springs, we have classes that we are willing and wanting to teach.
Now these classes you're saying so these are for beyond just Sandy Springs residents.
It is. We actually do a CPR class, and everything that we do is free of charge.
Mm-hmm.
Again, we do a basic first aid like we're doing today. I taught Wednesday evening, I taught a disaster drill, disaster training, and an active shooter class to a surgery center just down the road. So if there's anything in particular that you as a company would like to see, we can, if we don't have a PowerPoint and a program for it, we can make one. Or anybody individually, if you have something that you need in particular, we will get you my information and please reach out.
I do have a follow-up question. That active shooter drill, is that something that you do via Zoom, or is that something you do in person, or what?
No. I can do via Zoom. I have a PowerPoint presentation, and then I actually have a video that from Homeland Security that we play as well. So yeah, everything can be done via Zoom.
We might have to invite you back another time later on in the year. Atlanta's, well, it's probably not Atlanta, but it seems like every day in the news, it seems like there's more and more shootings. And so
unfortunately, we had to make a program because of that very reason. You know, it's something we don't like to think about and don't want to think about, but it's our reality. And so we have to be prepared.
It very much so is our reality. So I'm definitely going to reach out to you about that and just circle back around and get you back in and do an active shooter drill, because that's scary and it's super relevant.
Please do.
Yeah.
Yep, absolutely. Please do. All right. So are we ready to start?
I'm just taking notes. Don't mind me.
Okay. All right. Again, we want to empower you as you are the first responder, because you're going to be there at that scene before we ever even get the phone call. You're going to see exactly what happened, when it happened, and what else is going on. So you are vital to the entire scene and the whole scenario of that situation. So some of the topics we're going to talk about today, we're going to talk about our trauma, which we're going to do some bleeding control. We're going to learn how to do some sprinting with fractures and sprains, talk about insect bites and stings. We're going to talk about just general heat, exhaustion, and dehydration, kind of what the differences are between the two. And then on the medical side, we're going to talk about what the difference is between a heart attack or cardiac arrest and heart attack, because they are different. Talk about what happens if somebody's having a seizure and what it looks like if somebody's having a stroke.
Okay, sounds good.
So we have a program that we call, and it came from the state. It's Stop the Bleed, and it's their like big campaign in their program that they started. And basically, it's just talking about the bleeding control. When you see serious bleeding, we all understand and know that we only have a certain amount of blood in our body, and if too much comes out, unfortunately, we're not going to be around. So the biggest thing is applying direct pressure on the actual spot that's bleeding. And sometimes that may be hard to find, but you kind of, I guess really depends on how well you like the person. And hopefully you like them well enough that you want to see them tomorrow. So applying that direct pressure. And then if need be, we can, there's different products and that different manufacturers make where, if it's a large enough wound, there's actually things you can put in wounds that will help absorb and stop the bleeding. But all we're really looking at is just direct pressure and get it elevated above the heart is our biggest concern with whatever's bleeding. We want it to stop. So when you're dealing with your lower limbs and your legs, lying them down so we can get the leg elevated to get it above the heart. And then obviously our arms and things like that, we want to get up as well. Applying a tourniquet, they have several different, even just tourniquets that we carry, but a simple belt, a shoelace, anything that you have to use is okay. You just want to make sure that wherever the wound is, you want to go above it, obviously, but we want to go and continue that a little bit more. We want to go above the next joint, meaning if it's in their forearm, we want to go above the elbow. If it's on the shin, we want to go to the hamstring. Now, obviously, we can't tourniquet around a belly or chest or anything like that. So higher than the wound on legs. And again, same thing with the arms. Higher than where the wound is where we want to put a tourniquet. And then obviously calling 911 as soon as physically possible. We hope, right at the beginning, but just that very second that somebody can call 911, we absolutely want that to happen so we can get there and start to help.
Awesome. And I just want to point out everybody listening that especially in the home office, our first aid kit and our first aid supplies is inside of the break room. We have a whole dedicated cabinet right up under the sink. We're right next to up under the sink that says first aid. You open that door, you'll be surprised at how much first aid stuff we have in there. It's awesome.
And I would absolutely encourage everybody that's in that office, especially, and then wherever your office is, to ask someone, hey, do we have a first aid kit? Secondly, where is it? And I would really encourage everybody to put their eyes on it, open up the case or the bag or whatever the case may be, look inside there and see what's in there. It may be a case and people may have gotten in there and all of a sudden there's nothing but Band-Aids in it and you need more than that. So looking at that and periodically checking it is really huge. And especially to know what you have on hand could save somebody's life.
Exactly. Yep.
All right. When we're talking about the fractures and the sprains, obviously, again, we want to control the bleeding and our fractures. Now, a compound fracture, as you can see on the screen, a compound fracture is meaning a bone has actually come through the skin. That is what we consider a compound fracture. So controlling the bleeding is obviously going to be very important. And then don't attempt to move the patient. Wherever they are is where they need to be. Now, only time you would move somebody is if they were in further danger of any kind. And so that's going to have to be a judgment call. But if there's no danger where they are, we're going to leave them right there and get them the help they need right where they are. Obviously, ice packs for swelling and pain will definitely, help in the long run for sure. Wrapping it so you can take your hands off and help them do something else. If we have an ace bandage, anything like that, some gauze we can wrap around. And then when we're splinting, if you have to do something like that, again, we want to splint above and below the injury for sure. Obviously, we're not going to splint right on the injury, but we want to go above and below the injury site, and we want to go to the next joint if possible. And
Can we
splint that.
Can we say what a splint is, just in case?
I'm sorry?
Can we say what a splint is, just in case they don't know?
Yeah, absolutely. Of course, on the fire trucks and the ambulances, we have splints that actually unroll and then they'll kind of form to the arm or to the leg. But I mean, a splint can be absolutely anything that you have. If you have to use a clipboard, if it's the bottom of the leg and the clipboard is all you have, but anything hard and rigid that's not going to bend can be used as a splint.
Mm-hmm. Yep.
And then the same thing with wrapping. Obviously, we're not going to duct tape them, but gauze is a great thing. That's why I suggest finding out where your first aid kit is to find out what you have in there. But again, if we don't have anything else and we have a few people that are there helping, I mean, if we have to use a belt to get that thing tight because we don't want it to move anymore, once we put it on that hard, rigid surface of whatever that might be, getting that thing immobilized so it doesn't move and injure them anymore is the ultimate goal and what we're trying to achieve.
Now, we have a question. Elizabeth says, would cardboard work? And
absolutely. If that's all you got, and if you can double it up to make it a little stronger, great.
Yeah.
But if not, yeah, absolutely. Cardboard would absolutely work, especially in an emergency situation. Again, we're going to use whatever we have.
Gotcha. And I heard you mention tape, so duct tape. So is that like for real? Like, don't use duct tape. Don't use it.
I probably wouldn't use duct tape only because we know how strong duct tape is. And if we put it too tight, we're going to stop the circulation even more. And if we don't have to put a tourniquet, then we don't want to stop that circulation. So, again, another judgment call for sure. But go ahead.
Yeah, the reason I asked is because I had a friend and we had to actually create a tourniquet using duct tape, and it's powerful.
Oh yeah, and again, if that's what you've got, I mean, I promise you, they're going to be happy if they wake up tomorrow and they've had duct tape and they have all those sticky spots on their arms or legs or wherever it went. Sure, you can use it. It wouldn't be my first choice, but it certainly would be in top 5.
Yeah, better than nothing. They're saying Elizabeth said she actually had to use cardboard for someone in a kid in school. So yeah, we have some first responders here already.
That's awesome. That's awesome. I love to hear that. When we're talking about sprains and strains, really, we've all been there. We've twisted an ankle over the years. The biggest thing is, and we use the acronym RICE, and all that means is we want to get rest, ice, compression, and elevation. Again, we want to get it above the heart if we can, because that's going to be the best. And that's going to control the swelling, and that's going to control just, hopefully it eases some of the pain. And then the compression is just getting that ice tight on the area that's injured, meaning we can use the gauze or use something to get it tighter on that area to compress it. All right. Well, now we're going to talk a little bit about burns. And biggest things to remember about burns. Some of us are older and, we've always heard, different things that home remedies.
Butter.
and actually butter, you can see, is the second point of topic on this slide. Don't use it.
Oh.
First of all, obviously we want to remove any jewelry and clothing because we want to expose the area that has been burned. Not only because it's going to start either sticking to it, and then they're going to have that pain of having to have that removed, scrubbed off. So yeah, we want to get everything out of the area where the burn is. Obviously, unless it's stuck to whatever has been burned, we're going to leave that there. But if you can remove it, remove it. It'll just happen. It just is a lot better in the long run. But here it talks about, if you can run it under cool water, but never ever use ice, butter, or any ointments out in your setting as the first responder until we get there. So I'm glad you said butter, because that's typically what we see, and definitely what we hear. Yeah, I've always heard use butter. Well, I'm telling you right now, that's not a good idea. So
does it make the situation worse? What does butter do?
No, it doesn't make it worse. But there's really no helpful benefits to using that.
Okay.
And now you've just created another mess, because eventually that butter, if it's in the wound, that butter's going to have to come out, because they're going to have to scrub it, clean it, and get it healing. And a butter is a foreign substance to the body. So eventually it's going to have to come out.
Gotcha.
All we ask is you just lightly cover the area with some type of cloth or a bandage. And again, gauze is great for that, because gauze has already gone through that little process of not having the lint and the little pieces. When we pull stuff out of the dryer, that lint trap has always got stuff in it. Gauze is going to be free of lint, and it's like, dust free, powder free, all that kind of stuff. So, we encourage gauze just because it's already been through some of the processes. But if you have to cover it with your shirt, somebody else's shirt, whatever you have to use, but again, just lightly cover it. We don't want you to cover it up and wrap it and tape it, because a burn is a little different from the injury and the sprains that we talked about earlier. Burns are obviously treated a little differently. And obviously, any kind of serious burn, you want to seek medical attention, whether that's, with your primary care physician, or obviously if it's bad enough, you're going to call 911. And we all know that, 3 degrees of burns, but there's actually the country and those powers to be have a 4th degree now, which is basically total destruction and burned of the area, where unfortunately, they're not going to even feel any pain with a 4th degree burn, because all the nerve endings and all the pain receptors, everything in that area has been burned completely away. So, your 1st degree is that little bit of sunburn that we've all probably experienced one time in our life. 2nd degree is a bad sunburn with some blisters. And I'm guilty. Fell asleep on the beach too. And then, your 3rd degree burn is going to actually get down in the tissue, but you're going to feel a lot of pain. And again, like I talked about, the 4th degree is where they're not going to feel any pain at all. And, again, you as that first responder, you're not going to really treat it any differently, other than if we can get it cooled off with some water, getting a light covering on it, calling 911. So just wanted to kind of, describe the different degrees. But for you guys, and even really for me as a first responder, we're not going to do anything different now, other than if it's a very severe, even 2nd degree burn, would make our decision whether we're going to go to Grady, who has a burn unit, or if we can go to a regular emergency room. So other than that, treating it, we're not going to treat it any differently, other than identifying how bad it is going to depend on which facility we go to.
Now, when we lightly cover the area with a cloth or bandage, should we keep that wet? The cloth?
Moist, yes. Moist, not dry.
Okay.
So yeah, it doesn't have to be soaking wet where it's dripping, but definitely run some water, cool water over it, whatever it is, and then just place it on top. Now we're going to talk about a little bit about stings and bites. We all know typically that bees, wasps, ants, spiders, and all of that, they're not usually have any toxic and any kind of allergic reactions unless you know that you're allergic to that particular insect. And so, but just remember that, you know, sometimes somebody may not know that they're allergic to a bee sting or that spider. And, you know, that's when you run into the serious problems. And we call that anaphylaxis, which means that they're going to start to having trouble with their breathing. They're going to start to swell up. And when I say swell up, I mean their entire body, not just the area where that got stung. I'm talking about their entire body. They may start having chest pains. So anaphylaxis, just like it says here, can be fatal if it's not treated. And then if we can remove that stinger, if we can see it, and all we want you to do is just kind of brush it off. We don't want you to go in there and do any kind of surgery. And, you know, because you stayed at the Holiday Inn last night or you watched a medical show last night. No, just want you to kind of just wipe it off to see if we can get that stinger removed.
Speaking of a medical show real quick, what's your opinion on like WebMD? Like, should we go searching WebMD for some of these, you know?
If you search WebMD because you woke up with a sore throat, by the time you log out of WebMD, you're going to think you have the worst virus and
Ebola.
And you have about 10 hours to live. So,
yeah, it's horrible.
So no, call your doctor. If,
yes.
You know, WebMD, I promise you, you're going to have a fatal,
oh my God,
some type of illness that you're not going to see the sunset. So, exactly. So no, I don't recommend that. But of course, I'm not going to tell anybody not to. That's, exactly. You know, absolutely on your own. But yeah, my advice is I would probably stay off of that.
Yeah.
Now the difference is when your bites and your stings, we're going to run it under the cool water again, but at this time, ice is going to be okay. And we want to apply that ice directly to the infected area. We don't necessarily need to wrap it and with the gauze and things like that, because typically if they're just having, you know, a little bit of swelling or redness in that area, they're going to be talking to us and, you know, they can probably hold that ice pack themselves.
Yes. Yes.
And so, you know, if they're conscious and are talking, you know, ask them, can you take Benadryl? And if they can, Benadryl is always a good thing to have for any type of allergic reaction. You know, no matter how small or severe, Benadryl is never a bad thing. Again, as long as they're not allergic to anything that's in Benadryl.
Gotcha. Quick question.
Yes.
You pointed out butter as far as being one of our hand-me-down remedies. What about tobacco? The inside of a cigarette for like these things. Have you heard of that?
I have, and that's another one of those myths that I'm going to tell you doesn't work.
Okay.
We've all had that one, you get stung out on the backyard playground and that uncle comes with his tobacco. Yeah, I've seen it, been there, done that, heard about it. I personally don't know of any benefits to any type of tobacco. And when you check that WebMD again, you know, maybe it will tell you to, but I've never seen or heard of any benefits from it. Gotcha. So, but on the other hand, you know, I don't know of anybody that's died by getting that done. So, you know, if that makes that person feel better.
Yeah, that placebo effect. Maybe the placebo effect.
You're exactly right. You're exactly right. You'll know pretty quick. I mean, within the first couple of minutes, if somebody is going to have a severe reaction to any type of bite or a sting, it's going to come on really quick. And that's when, again, they're going to start having that difficulty breathing. They're going to start saying that it's getting hard to breathe or my throat is swelling, their lips, throat. That's immediately when we're going to call 911 because a serious problem is getting ready to happen. And again, once they get bit, stung, within a couple of minutes, if they're going to have a reaction, typically that's when the reaction is going to get worse really fast right away. So not saying it won't happen over time, but generally going to be pretty quick, and you're going to know that this bad situation has now gotten even worse. So and there are people, and hopefully, your coworkers, and somebody says that, I have an EpiPen. Well, I know there's HIPAA laws and things like that, but if you're close enough to that person as a coworker, friend, say, hey, does it involve, you can be generic about it. You don't need to know their medical history other than, hey, are you allergic to a certain type of bee sting, or is it a wasp, or is it ant, something in general, I would like to know, because if they have an EpiPen, they have it for a reason, and they were prescribed it for a reason. So, that might be a conversation that, one-on-one, rather than, obviously letting the whole company know and things like that, because your medical stuff is your business. But
I promote that wholeheartedly. I actually had a friend, I worked at a motorcycle shop repairing motorcycles, and the owner, I guess he was too proud to let everyone know about his situation, and that he had a medical condition, until one day it came full frontal and we didn't know how to handle it. We found out after the fact, but we were like, dude, don't ever be ashamed to let us know, because it might save your life. Let someone know.
Right.
So I'm all about
exactly.
that accountability buddy.
Exactly right. That buddy, and that buddy system that you use when we're evacuating business, when we have to evacuate for fire drills or whatever the case may be, same kind of thing. Again, I'm not telling you to put out your business, but it would be nice for at least one coworker, and probably I would say two, because we all know Murphy's Law, right? The one day that your buddy that knows what's wrong is going to be out that day, or in a meeting, or not around you. So,
go wrong. Yeah.
Exactly. Just a core group that you can trust, that's not going to blab. But again, there's nothing wrong, and it's not shameful to have it.
Yeah.
But again, it's your business.
Yeah.
So if you confront somebody that has a sting, or any type of allergic reaction, again, that doesn't have to be, just down to bites and stings. Do they have a peanut allergy? Do they have a fruit allergy?
Right.
If they have an EpiPen, they have it for a reason. And so if they have it and they know how to administer it, all you want to do is assist them. And if they need help, because you can go right through your pant leg, just like you see in the picture, EpiPen will go right through your pants, your dress, whatever you have on, long sleeves, doesn't matter. Obviously, they want it to go in the thigh right here. So, there's nothing that you need to do. They don't need to be undressed. If for some reason they're either unconscious or semi-conscious, we're going to lay them down. And if they have that EpiPen, you can administer that EpiPen right into the thigh. And it's all done spring loaded. So there's nothing you have to preload. You don't have to dial up a certain amount of dose. These things are just a stick. It does the rest.
Awesome.
And again, this is what we were talking about a little bit earlier. Your difference between an allergic reaction and an anaphylaxis. Your allergic reaction are going to be just localized to the infected area that was either bitten or stung. And obviously it can become systemic, and affect the respiratory. But again, you're going to know that pretty quick. Now, if you don't know what bit them or what stung them, then, we have to think about worst case scenario, especially if you guys are doing lunch, outside that day at the picnic table and things like that, because it'll be a little bit harder to find out what bit somebody or stung somebody, as opposed to being in your office. So, and then anaphylaxis is that severe reaction, and it most often will affect multiple body parts in your body systems, meaning your entire body is going to start to swell, or your throat's going to start to close up, or both, or your chest is going to start hurting. There's going to be several things that are going to happen really fast.
Nice. We actually had a question about that. Elizabeth, that's your answer right there. You have an allergic reaction versus anaphylaxis. So Her question was, is it normal to just swell up really big in the area of the sting? And
100%. Yes.
Yep. Mm-hmm.
Yep. And, most of us are, and that's our body. Whenever we have something that happens like that, say a bite or a sting, our body starts working in overdrive and sending the good stuff to that area to start combating it. And
Yep.
so, yeah, that's why you're going to get the swelling. You're going to get, it may be a little bit red. It may become a little bit warm, but that's your body's defenses attacking whatever that foreign thing happens that has come into your body. And again, go ahead. I'm sorry.
I have an 8-year-old and a 6-year-old, and I tell them that's a little battlefield right there.
Right.
The body's defending itself.
Exactly right. And that's exactly what it's doing. And when we're talking about the anaphylaxis, this is where I'm talking about with the severe respiratory distress. Like they absolutely cannot breathe. They're wheezing. It's hard for them to talk. I mean, they are in trouble and it's happening very fast. And then the hypotension, meaning their blood pressure may be affected, and hypotension means their blood pressure is dropping to an unsafe level. So your differences between your allergic reaction, which is localized, to anaphylaxis, which is going to affect more than one body part and one body system. If we have to use an EpiPen, again, you want to know that person, it's obviously prescribed to them. You don't want to use your buddy's EpiPen on somebody else. So if they have the EpiPen, then it's absolutely 100% safe to use it on them because it's been prescribed to them. You just want to ID what's going on. Is it a rash, the swelling? Is their throat starting to have problems? Is their mouth starting to swell? Are their lips starting? Is their tongue? Are they having any trouble with speaking or even swallowing? You may not see the swelling in their throat. It may just all be internal and you don't see it, but all of a sudden they say, man, I can't hardly swallow. Something's going on. Obviously, if we use an EpiPen on somebody, we want you to call 911 because we want them to get checked out, because like anything else, an EpiPen is going to react and it's going to do its thing, but it's going to do its thing very fast. And if something else is going on, those symptoms are going to come back when that EpiPen wears off. So if an EpiPen is used, you call 911, let us come, let us take them to the hospital, get them checked out, so nothing else starts to come back and give them problems, in an hour, 2 hours down the road. Avoid placing on your the hand on ends and remove that cap. And the cap is going to be blue on an EpiPen. So it should be very easy to recognize the cap. We remove that. And then all you have to do is hold the pen firmly, placing the orange tip against the patient's thigh and push. It's spring loaded. The needle will come out. It'll go in. Then you just hold it there for a couple of seconds, remove it. And we just want to rub that area. It says here for about 10 seconds. And that's it. There's nothing else that you need to do other, medically. Obviously, we've already called 911. Hopefully, we've helped or assisted them, or we had to do the EpiPen ourselves on that person. Now we're just waiting for the help. And hopefully, we start seeing a change in them for the better.
Are there markers on the EpiPen that let you know when the contents have been depleted, or you
once you shoot it, it's going to come out and the dose is already preloaded. So once that spring, and it's definitely something that just happened.
Okay.
It's not going to be like a punch, but you're going to know that has already expelled, and it's a single dose in, out with the needle. Once it goes in, it's done, and it again because it's spring loaded and it's got a little bit of kick to it, so you'll know. Right. Hey, there's not going to be any question, did this work or didn't? If you don't think it did, it probably didn't. And, it's okay to try it again, because maybe it was, to the side a little bit, or,
Gotcha.
did we remove that blue cap or not? So
You have to
you'll
shake it or
know.
anything? You have to shake it
No,
up? Nope.
no, nope. It's just ready to go. It's already loaded in there. It's just, and what happens is the outer ring
Mhm.
depresses, and then that's what shoots the needle.
Gotcha.
So,
Gotcha. Gotcha.
all right.
This is a big one.
Yes. Talking about heat exhaustion and then your dehydration, because people always say, oh, I'm dehydrated. Well, yes, you are dehydrated, but you may be going and having heat exhaustion, which heat exhaustion is deadly. So some of the symptoms of your heat exhaustion: heavy sweating, feeling weak, you start turning pale and cold or clammy. Either you can have a very fast pulse or your pulse becomes very weak. Either one, obviously, we all understand that that's bad.
Mhm.
Either some nausea or vomiting. And then obviously fainting is going to be a sign of heat exhaustion. Dehydration, yeah, you might feel a little bit sluggish, a little bit weak. And I'm thirsty. You know how we all have gotten that feeling. I need to drink something. Your throat's parched or whatever the case may be. But this is where we're talking about, we're past that part. We're getting into a danger area. First thing we want to do is move them, get them to a cooler location, wherever that's at. Again, you're outside eating lunch that day. We're going to get them inside the building where the air is going. If we have to get them to a car or vehicle, turn the AC on. Again, any type of cooler location. If it's from the direct sunlight, now we're in a shade. We may not think it's cooler, but I promise you it is a little bit cooler. So, we can have them lie down. We can loosen some of their clothes, because you're going to feel like everything is tight and you just want to just take things off to feel like you can breathe and get air. So that may be something that you can do. That may be more placebo than anything.
Yeah.
Again, we're going to apply cool, wet cloths everywhere. And when I say everywhere, around your neck, because you have your carotid arteries around your neck, underneath your armpits, because we have the brachial arteries under here, and we want to get up in the thigh area near the groin, because you have an artery there. Those are really good places to start, especially here and here. I don't know how, well you're going to know the person. So, reaching in the crotch area may or may not be, a good idea, but definitely around the neck and completely around the neck, to where it's going to get those carotid arteries, because they're more here than on the backside. And then just up underneath the armpits is great, because they can put their arm back down, and now it's secure, especially if they're just lying down. They're not going anywhere. Their arms are going to keep it secured for you. So, and then if they're conscious and able, drinking water. But I have to really stress, we don't want you just to gulp the water down. You think, well, I got dehydrated, now I'm going to just pack it in really fast, because what's going to happen is you're going to put too much, and it's going to upset your stomach, and then it's going to come right back up, and now you're still dehydrated. So sips of water, just, almost continuously, but giving yourself a little, a couple of breaths in between, not guzzling the whole bottle after another. And then again, anytime something doesn't look right, always call 911 and seek that medical attention. When you get home that night, if you're not feeling well, call the 911. Hey, I had an episode today, just not feeling right. Maybe, the bottles of water you were drinking that you have drank wasn't just enough. Maybe you need an IV.
Yeah.
So getting that medical attention, obviously, is what we always encourage. But as that first responder, a few things at the very beginning makes all the difference in the world. I can't stress that enough.
A question from the chat: is such thing as cooling someone too fast in this situation? Could you?
No, not around here. Now, I mean, if you're jumping into an Alaskan water, yeah, that's probably a little bit overkill. But around here with, ice packs and things like that, it's not going to happen. And I mean, we even have the ambulances have even IV bags that are actually chilled. So it's going to be cooler. So no, rapidly cooling somebody is not really going to happen, especially, or for sure around Metro Atlanta, you're going to have help there pretty quick. So no, I wouldn't even concern myself and worry about that. But at the end of the day, if somebody is look like they're getting ready to just pass away and you cool them too quickly, but they're awake tomorrow, I promise you they're going to thank you. So yeah, don't even, worry about that kind of stuff, because that immediate threat is what we're looking at. That.
Gotcha. What about ice? Could you give someone ice? Is another question from the chat. Could you give someone ice to sip on, or one cube of ice, or one small piece of ice at a time? Especially softer ice, I guess.
Yeah, I mean, you can. You just really want to make sure that they're not, on the verge of maybe passing out, because then it's going to choke them for a few seconds. So, sips of water, absolutely the best. Take that same few pieces of ice. If we can add a couple more, put it in a bag and put it up underneath that arm.
Gotcha.
All right. Now, there are differences when you have somebody having a heart attack and with having chest pains. Always have to remember that chest pains is a symptom of having a heart attack. But chest pains can occur from many, many different things that are going on. So don't always associate, just because you're having chest pains doesn't necessarily mean you're having a heart attack.
True. I see, Billy, I see there's a lot of on this. You know what? We should have scheduled you for more time, because we're almost at the end of our hour.
Well, I'm almost done as well. I was trying to space it out for that hour.
Me too. And man, this is a lot to unpack. So shoot.
Well, right. I'm always available, LA.
Exactly. But go ahead and continue. We have
all right. Some of the other signs and symptoms are going to be, discomfort and pressure in your chest. Mm-hmm. Some people say my arm is hurting. That is another sign that you're possibly having a heart attack. Your upper back hurts, and it says jaw. And we see that for some reason more in women that have jaw pain when they're having a heart attack, and then men. But it doesn't say it can't happen, but it absolutely can. And then, of course, we're going to have some sweating and the shortness of breath, or even having really trouble and difficulty while you're breathing. And again, anytime anybody's ever having any kind of chest pains, regardless of whether we don't think it's a heart attack, they're just having a panic attack, let the doctors decide that. Not you, not me, not anybody, because we just don't know. Call 911. Because especially if, we get there and we put them on what we call that 12 lead. And all that is those little stickers that go all over your chest and on your legs and on your arms. And all we're doing is reading your heart. Yep. And we're going to know pretty quickly, just by those little blips on the screen, if you're in an immediate danger or not. Believe it or not, by looking at those little blips that's on that screen. And then, everybody seen on the medical shows that just straight line with the buzzing noise, that means you're not, you're out.
Flat line.
Yeah, flat line. Asystole is what we call it, but flat line, you're dead. So we can absolutely tell you exactly what's going on. For the most part, they have to draw blood, because that's the definitive way they know exactly what happened and what is happening. But those little blips will tell us a lot too. Lay the patient flat on the ground. Keep them calm, obviously. Mm-hmm. If the patient has, for instance, if they have nitroglycerin because they already have a heart condition, if they have that and you can get to it, you can absolutely assist them in taking their own medications. And I haven't been to your floor, so I don't know whether you guys have an AED on that floor or not. And
we do have an AED on our.
Okay. And then, whatever other offices you're in, AEDs they absolutely will save lives. And so if your particular office doesn't have one, I would really strongly suggest that you at least get that conversation started. Hey, can we get one? I mean, they literally sell AEDs now at Sam Clubs
and on Amazon. Yeah.
And on Amazon and Costco. So, I mean, it's not something that you're going to have to take a second mortgage out on anymore. So, and then obviously on the AED, once you put those stickers on, the machine takes over and it's going to tell you exactly what to do, when to do it, and it won't let you do something that's going to harm them. So, say for instance, somebody accidentally hits the shock button. It's not going to shock that patient unless that machine recognizes that they are in that flat line, and that's when it's going to do it. So putting on the stickers of the AED is not going to harm them at all. And two more, talking about signs and symptoms of a stroke. And I'm sure most, if not all, we've seen that acronym of FAST. And all it is face. We're looking for an uneven smile because part of their body, one side of their body is either starting to shut down or is not working. It affects all the muscles. And so they're going to have a droopy side. So we're going to be looking at that. The next is arm. And all we're doing is checking to see if one arm is weaker than the other. And simply by putting them out in front of them, does one arm drop without them being able to hold it up? Are they talking normally? Or does it sound like they're slurring, like they've had a few too many shots? And we know that wasn't the case because they were with us, right? And then again, the time, because there's only a certain amount of time to be able to reverse the effects of somebody having a stroke. The faster we can recognize it, identify it, call 911 and get them to the hospital is key. And then here it's just talking about if they're conscious, just support the head and shoulders, put them on a pillow if you can, because we all know the hard floor. Mm-hmm. Loose and tight clothing again, because their shirts and their tops are going to have to come off anyway when we're putting all those stickers on. And so all of that, so we're not going to constrict them anymore. And wipe away any secretions from their mouth because we just don't want them to start choking, whether that's too much saliva or if there's vomit. Again, you feel comfortable enough to wipe all that stuff away, please do. It's saying maintaining their body temperature. I don't know how, realistic that is, because you're only going to have a short time, and getting them talking and, in the position of comfort and calling that 911 is so much more important. But, obviously if they're in the hot sun, we're going to get them out of there.
Mm-hmm, exactly. And
then again, ensure that the airway is clear and open, meaning they're not just choking and that there's something else going on. If they're coughing is a good sign, because that means they're at least moving air. And here again, there is a difference between a cardiac arrest and a heart attack. And in a cardiac arrest, it says it occurs when the heart malfunctions and stops beating unexpectedly. Mm-hmm. Where a heart attack occurs when blood flow to the heart is and becomes blocked. So either way, learning CPR, I encourage everybody to do it, whether you are in Sandy Springs or in your local community. Find out where they do it, where they give it, take the class. The CPR that we teach is basically hands-only CPR. It's not like the old days where you had to put your mouth on their mouth. I mean, as first responders and a firefighter, I'm not putting my mouth on somebody. I did when I first started my career 30 years ago. I mean, that was standard practice, but that was disgusting. And I get it. So we teach a hands-only CPR because we have found, and the statistics will back us up, that getting that compression in that heart, even if it's beating by you because you're manually pushing on that chest, getting that heart beating will be better than that breathing into somebody's mouth that you wouldn't, even want to kiss, let alone do that. So, and then again,
each compression is pumping blood through the body, right? You got to push deep.
Exactly right. And you're doing exactly what the heart is doing, but now you're just doing it manually because their heart can't do it.
Right.
And then again, knowing where that AED is.
So how does that, so if it's a blockage, I understand that working in a cardiac arrest, but if it's a heart attack and it's blocked, aren't you still having to contend with that blockage? You
are. And when they're having a heart attack, typically the heart attack is going to be a slower process because that blockage is getting bigger and bigger and bigger. Yeah. So hopefully they've gone to their doctor and they've followed up with that. This is doing the compressions and things like that are really for the cardiac arrest, where that just heart just has stopped for whatever reason. Yeah. So, but LA, that's all I have on the presentation. I want to thank everybody for coming and listening to me for an hour talk. It's been my pleasure. And again, there's a lot more classes and a lot more of these that we can do. Please let us know whatever we can do. This has been awesome. Like, it did not feel like an hour for real. I was surprised when I looked at my watch and it was like, 12:50. I'm like, oh man. So I'm definitely going to have you on again, man. I would love to do the active shooter or something like that. Sure. And everybody listening, I hope you guys gathered a lot of information from this. This is awesome. Thank you so much, Billy. You definitely empowered us. Oh, you're welcome. And one more thing, LA, I will pass along my contact information. Okay. So if anybody has any information that they need to just ask me, call, email, text, whatever is easier for you. Okay. Unfortunately, that city phone is always on, kind of thing. So it seems like we're never off duty completely. Exactly. I send these out, the Empower Hour. I send this recording out because this was recorded. I send this out in a wrap-up email every Friday afternoon. So I will do it today, and I will take your contact information and add it to that email. Awesome. So yeah, again, please, no question. We always heard that there's no dumb question. And I sincerely and truly mean that. If there's something you want to know, something you just think about next week, next month, tomorrow, whatever the case may be, if LA doesn't know the answer, he can, get with me, or you can just contact me directly, please. Exactly. So thank you so much. And I mean it. I want your address. I want to send you something. Yeah, I'm going to do it right now. All right, cool. All right. Have a good day. Thank you, everybody. Thank you. Bye. Bye-bye now.